after advice to avoid all non-essential contact and all non-essential travel. The advice, a stark contrast to what the government was saying just a few days ago, was delivered by the Prime Minister and his chief medical and scientific experts.
We are asking people to do something that is difficult and disruptive of their lives, and the right moment, as we've always said, is to do it when it is most effective.
New measures are particularly important for anyone over the age of 70, for pregnant women, and for those with certain underlying health conditions.
Those three groups are the groups we want to take particular care to minimise their social contact, which of course will have very significant risks for them.
The impact on the economy is going to be very damaging. Aviation firms are among those badly hit, but it's not just big business that is suffering. And we'll be reporting on the growth of community initiatives in all parts of the UK, offering support to those in need.
At 10:30, where the Prime Minister says Londoners need to pay special attention to the advice about coronavirus because the outbreak here is a few weeks ahead of the rest of the country.
Good evening. As the pandemic of coronavirus claims more lives around the world, the people of the United Kingdom are now being advised to make drastic changes to their day-to-day existence. Prime Minister Boris Johnson rejected criticism that his government had been slow to respond to the scale of this crisis. Mr Johnson said now was the moment to stop all non-essential contact with other people and to avoid all non-essential travel. The over 70s, pregnant women and those with underlying health conditions, they all needed to be particularly vigilant. Entire families must self-isolate for 14 days if just one member has a persistent new cough or a high temperature. From this weekend, those with the most serious health conditions should be isolated from social contact for 12 weeks. The advice came as the number of confirmed cases in the UK rose to 1,543 and 55 people are now known to have died from the virus in the UK. That's an increase of 20 on yesterday. The Chief Medical Advisor warned that the new restrictions on people's lives would need to last for a long while. Our health editor, Hugh Pip, has this first report.
This evening around the UK, the streets were a lot quieter than usual after an extraordinary intervention which will affect everyone's daily lives. This is a huge and unexpected step change in the government's response to the coronavirus crisis. The Prime Minister said drastic action was needed to slow the growth in cases. He had a series of messages, first on household isolation and those with a persistent cough or fever.
If you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out even to buy food or essentials other than for exercise, and in that case, at a safe distance from others.
There was guidance on social distancing for the whole population.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues.
The over 70s and pregnant women were urged to be extra vigilant.
Infections and pregnancy are not a good combination in general, and that is why we've taken the very precautionary measure, whilst we try and find out more, to include pregnant women in the group alongside older women and people who've got pre-existing significant health conditions. We may in retrospect find that was overkill, but we'd rather be more cautionary now rather than the other way.
Many people, including millions of fit and active people over 70, may feel, listening to what I've just said, that there is something excessive about these measures. But I have to say, I believe they are overwhelmingly worth it to slow the spread of the disease, to reduce the peak, to save life, minimise suffering, and to give our NHS the chance to cope.
Isolating the sickest is to be an immediate priority.
In a few days' time, by this coming weekend, it will be necessary to go further and to ensure that those with the most serious health conditions are largely shielded from social contact, for around 12 weeks.
The NHS, meanwhile, is pushing on fast to make room for the inevitable surge in patient numbers because of the virus. At the Mater Hospital in Belfast, they're preparing specialist beds with ventilators. Nurses are being trained in using protective clothing to care for patients who've tested positive.
It's warm, it's challenging, it's like you're in the desert, really, basically, and there's no air.
We can only be in there for about 40 minutes at a time, so trying to do everything that we need to do for that patient in that time frame to keep ourselves then safe with the risks of the masks.
Hospital leaders point out that most patients will recover quickly and won't need specialist care, but they're worried about the large volume of cases expected.
I think what scares us is the potential for the numbers of patients that could come. And we don't really know how many could come at the moment, but we have been preparing for the worst, absolutely preparing for the worst. But I'm confident that we are prepared for that.
But some doctors elsewhere in the UK say the NHS isn't prepared for what's coming.
We are not ready. We're running out of masks already. We haven't even started into the crisis really. There's a crucial lack of ventilators, and even our oxygen supply might be in danger.
It's a dramatic shift in policy, and critics will say it should have happened sooner. But officials here at the Department of Health say it was only today when government scientific advisors predicted a significant escalation in case numbers, requiring radical new measures. It's the biggest public health policy intervention in peacetime. It'll have profound implications. No one knows how long it'll last, and when these streets will be buzzing with life again. Hugh Pym, BBC News.
Well, as you were saying there, today's announcement marks a significant shift from the government's position last week. Minutes before the news conference took place today, the World Health Organization called for stronger measures than the UK and some other countries were taking. And officials are now convinced that the UK is on the verge of a major surge in cases, and there are genuine concerns about the impact on the NHS. Our medical correspondent, Fergus Walsh, has more details.
These images of makeshift field hospitals from northern Italy explain why such drastic measures are being taken in the UK. Coronavirus cases have overwhelmed some critical care units in Lombardy, with over 800 people in intensive care there. That's why a key aim is to slow the spread of coronavirus in the UK. It's estimated we're 3 weeks behind Italy, and if no action is taken, the epidemic here will double every 5 to 6 days.
The objectives are to really suppress the curve in order to keep it below NHS capacity, so that the NHS can cope, and to shield the vulnerable and those most likely to get severe disease, so that we protect them across this period.
The aim is to reduce deaths and minimise suffering. 4 out of 5 people will have a mild illness, but a significant minority will need hospital treatment due to breathing problems and pneumonia. 1 in 20 of those infected may need intensive care. The UK has around 5,000 intensive care beds. If there's too much demand, then patients could die if there aren't enough ventilators, and it could also cause deaths in patients with other serious conditions.
If the NHS became overwhelmed in any of the 4 nations, if the intensive care units got to the point when they were overwhelmed, then people would die from indirect deaths because they did not have the ability to get medical care.
The government is relying on sophisticated disease outbreak computer modelling to predict how best to control the pandemic. It's thought there could already be up to 50,000 cases of coronavirus in the UK.
These measures are going to have a major impact on society, indeed even on health in other ways. There will be unintended consequences. They're going to shut down a large chunk of the economy. I think that I think you have to be very sure you need them before you introduce them. Neither do you want to leave it too late.
Government policy has shifted because new modelling suggested there would be a catastrophic epidemic with up to 250,000 deaths predicted unless attempts were made to suppress the outbreak here. But an effective vaccine could be 12 to 18 months away.
Fergus is with me now. Fergus, I'm going to pick up on that last point about projected deaths, which will have no doubt alarmed lots of people. What's the government being told behind the scenes by its own advisors that's prompted this dramatic shift in policy?
It's new modelling that's come out of Lombardy in the past few days, just showing the level of intense impact on intensive care units from the virus. And the advice was that if we carried on with the policy that was there only last week to mitigate and not completely suppress the outbreak, that we would have this catastrophic epidemic with the prediction of potentially up to 250,000 deaths. Now, this is obviously only predictions, but by trying to suppress the virus now and putting in these extraordinary measures, the hope is that those deaths could be reduced to the thousands. Now, the problem with this is there's no exit strategy, and this applies to all countries around the world who are involved in lockdowns or other restrictions, because as soon as you lift those restrictions, the virus can come back again. It's thought that the current wave could peak at about 10 to 14 weeks, but we don't have any effective treatments. A vaccine could be 12 to 18 months away, so we really are in this for a long haul, and it's how much society can deal in the coming months.
Fergus, for now, thanks. We'll talk again before the end of the programme. Thanks very much. Fergus, our medical correspondent. Now, in every part of the UK, people have been taking in the full import of the government's latest advice, which marks, as we say, a very sharp change from just a few days ago, with advice to everyone to stop non-essential contact, to avoid the pubs and the clubs and theatres, etc. The change in people's lifestyles will, of course, be significant. Our correspondent John Kay has this report.
Bristol tonight, but this could be anywhere in the UK. New advice from Westminster means life is changing.
When is normality going to come back again?
Laura and Anne's trip to the theatre was suddenly cancelled.
It was going to protect all of us. Good thing that they've done what they've done. But it is scary. It's scary that this kind of takes control out of our hands at this point.
It's unknown territory, isn't it? We just got to see what happens. And it's scary for everybody.
The new guidance on avoiding crowded places means Jemima and Greg might have to rethink trips to the pub. But they don't think gatherings should be banned altogether.
Down to the individual, isn't it? You want to go out, go out. Will you go out? Yeah. I'm out.
In my environment, no one is really too scared, more annoyed, I think.
This will be the last bus we use.
Joanne and Lily are changing their plans, but they're still not quite sure what the Prime Minister means when he says to avoid non-essential travel.
I don't know how it's all going to be applied. It all seems very inconsistently applied at the moment.
What do you think's inconsistent?
Well, some people say they're going to stay at home, some people say they're going to go out anyway, and I don't know if anybody has actually really got it in their head that we might actually have to change our ways quite significantly.
It's weird. It's weird.
Lawyer Zach thinks she'll now be walking to the office or working from home.
As I understand it, we've been told what we're supposed to do, what the government would like us to do. I don't think it's as hard line as to exactly what to do. But
would you like it to be harder, clearer?
No. I think at times like this you've got to trust people.
Those with the most serious health conditions must be largely shielded from.
Suddenly, a relaxing meal out is anything but.
I prefer the black and white.
After seeing what's happened in his native Italy, this restaurant owner says he would accept even tougher restrictions. If the government said, right, now you have to close down completely.
I will do it immediately.
You do that?
Without a doubt.
Even if that affects business.
That's life.
And life is changing for all of us. John Kay, BBC News, Bristol.
As we heard earlier, the Prime Minister said that the new measures were particularly important for pregnant women, for anyone over the age of 70, and those with certain underlying health conditions. Our special correspondent Lucy Manning has spent the day in Brighton talking to some of those vulnerable people with particular health concerns.
For everyone, life is going to be different, distant, and who can say for how long.
I also had kidney failure.
Natasha McIntyre Hall has a compromised immune system. By the weekend, everyone with significant health risks of all ages will have to stay at home for 12 weeks.
I'm partly really pleased that people are taking this seriously and that I have the best possible chance of protecting myself. Partly, I'm really concerned about how I'm going to manage to self-isolate for 12 weeks.
They saved the last dance for today. The older generation told, like everyone, they must step away from others and minimise contact. But the Prime Minister clear it's particularly important for the over 70s.
Simply to be told because I'm over 70 that I've got to stay at home is not, I know it's just not going to be in my interest in a way, although I know the intention is good.
It's Mothering Sunday next Sunday. Am I going to be able to go and see my family?
On the Hove seafront, fresh air is allowed, but most other people are to be avoided. We kept our distance.
That would be quite difficult because we're very social animals, but even so, we've got Skype for our family. We're calm and we're unafraid.
Social distancing needs to happen because when the older generation are out and about, they can't be sure if people have coronavirus but just aren't showing the symptoms. But there's a clear danger that social isolation is also likely to be a big problem.
I will be able to teach from home.
Readying to cut herself off, Jane Bellardo. Her daughter's already insisted her mum, a Spanish teacher, works online from home.
I'm in the age group 72 and I suffer with type 2 diabetes, so I am a vulnerable person.
I do miss you, but the good thing about all this technology is that actually now you kind of won't be able to get rid of me because I'm determined that we'll be able to do some nice things together, whether that's cook-alongs or book club.
For everyone, particularly the elderly, the vulnerable and pregnant women, these are going to be the most difficult months. A different world, said one scientist. Families split apart in the hope lives will be saved. Lucy Manning, BBC News, Brighton.